the nursing program, we provide 24-hour nursing care. We're part of the interdisciplinary team, and we provide all the needs for the residents, and care needs, medication needs, respiratory needs, and try to always be alert and in tune to their spiritual needs and their adaptation. They're looking to adapt to a new home. We want to meet any kind of misnomer or confusion about moving to a new home and new environment. So the nurses play a lot of roles, wear a lot of hats, because we are in a small community and frequently don't have the resources that some larger facilities have. So our nursing department is very important to our residents and their outcomes. Being compassionate to the residents that come to Signature Healthcare in Trimble County is so important, because when they come to the facility, they're scared, they're giving up their home frequently, they're leaving loved ones, and you have to be aware of that. You have to be compassionate to that need and be able to help them through identifying their fears. They frequently feel like this is their last stop, this is where they're going to die. And that's not always true. I mean, because one of our goals is to maximize their abilities and not focus on their disabilities. Do they think a little slower? Do they move a little slower? Sure they do. They're seniors. They're senior citizens, and we have to look at that and look at what part they do the best and maximize that and be compassionate to that. And it's not the end of their life. It's a new stage. It's a new beginning. It's an opportunity to create their own environment, their own home, their own way of life. At Signature Healthcare in Trimble County, I feel like our nurses aren't just nurses. They have to reach out, because we are in a small community and lots of them are related to our residents. They may be cousins, they may be granddaughters, they may be, we've even had husbands and wives that come to our facilities, and so our nurses have to be a little different than acute care nurses, or maybe a nurse that's in a urban area versus a rural area. We have to be compassionate to their full needs, because we are a community-based facility and our employees come from our community, and so do our residents. So they have to mesh. When a resident enters our building, we automatically feel like they could be a risk at falls. And we assess them and we put them on a program that we call Falling Star. And that identifies them as a resident that is at high risk for possible falls. But we feel like anybody that comes to our building could be at risk for falls, because it's a new environment. They're weaker than their normal state because they've been ill, maybe in the hospital, or maybe they've been at home and deteriorated. So everyone could be at risk for fall. And once we get them in the building, we learn their needs, and we learn that they can function maybe higher than we thought they could. Then we remove them from that star, and they become, more independent and are free to ambulate in the building. But if a resident has a tendency to fall and has fallen, then we have many interventions. I mean, as far as distractions, we can divert their attention into other arenas. We can get the chaplain involved. He's a very good resource. Our quality of life is a very good resource to give diversion. So there are many opportunities to keep these people safe and keep them from falling without using the old traditional ways of preventing falls. I think people in the past have had fears of their loved ones being restrained, and we like to only use a restraint in last resort. All right, when residents come to our buildings, frequently their medications is a question that is brought to us, and they want to know if they can bring their own medications, and we discourage that because we do have a pharmacy that provides our medications for them, and we educate them on the fact that we will follow their physician's orders. If he wants them to have their medications 3 times a day, they will receive their medications 3 times a day, 4 times a day. Whatever the physician's orders are, we will meet their needs. There are special occasions when a resident is very cognitive and very alert, and they can be assessed to do self-administration of medications, but there are a lot of guidelines that they have to meet to qualify to be able to take their own medications. But we do provide that full service for our residents that come to our building. We do pride ourselves on the interdisciplinary team because we feel like it takes all of us to make these residents successful in integrating into their new home and being successful in their therapy and rehab programs. There's so many emotions that flow in these residents, and we all have to be in tune to their needs and what's making them happy, what's making them unhappy. If there is a problem, we want to address it immediately and have meetings with the family and the resident to make sure that they're not worrying about something unnecessarily, and we have meetings that meet their needs. It takes all of us to successfully integrate a patient, and the only way of doing that is for us to all have the same goals and outcome for that resident, and that's for them to be successful in the integration to our building. In the past, when residents entered a long-term care facility, or as they were well known in the past, nursing homes, residents felt like that was the end. They were no longer going to be even able to choose when they get up, when they go to bed, when they take their bath, what time they eat their meals. Everything was chosen for them. That's one thing that Signature is trying to do, is to revolutionize that idea, to make that better, make residents feel that this is their home. They do have choices. They can tell us what time they want to get up, whether they want to go down to eat breakfast, if they want to eat breakfast in their room. Long-term care is no longer a nursing home where your life is dictated for you. It is a choice, and we pride ourselves on giving residents their choices so that they are happier and more successful in their transition to Signature Healthcare buildings.